Certainly encouraging to see the COVID infection rates coming down in the U.S. But we turn now to the Americans who have contracted the virus and specifically the surprising medical costs and financial devastation that can follow. Here's ABC's Stephanie Ramos.
It's been a little more than a year since 51-year-old California mom Patricia Mason had her life turned upside down by COVID.
I called my daughter up and I was like, hey, tell your dad I need to go to the ER. They knew I had double pneumonia, but I don't think they had COVID tests over at the hospital I went to. And they sent me by ambulance to another hospital.
After a month-long stay in the ICU last March to fight the virus, she was hit with a new paralyzing reality.
To come home and hear on the news, hey, the insurance companies are working with the government to make sure nobody has major bills. And then to turn around and get a bill for $42,000 is like, what the heck happened here?
Was that the first bill?
Yes.
For $42,000?
Yes.
And she's not alone. 6% of adults paid out-of-pocket costs for COVID-19 related medical care between May 2020 and May 2021, impacting millions of people. According to Fair Health, a national independent nonprofit that seeks to promote healthcare price transparency, the average charge for a regular COVID hospital stay is roughly $29,000 to $59,000, depending on a patient's insured status. Those numbers going up dramatically for hospitalizations with so-called complexities.
As soon as you bring in specialists, as soon as you bring in extra medical equipment, more scans, more testing, anything a hospital does is going to drive up the cost simply because most hospitals rely on what we call fee for service, which means whenever they do something, they charge something.
Many Americans had their charges waived through the CARES Act Provider Relief Fund, but some insured patients were not covered.
There was nothing that was done on a national level to let people know whether or not their provider was participating in this program or not. And there's this fight amongst insurers, many of whom said they would leave patients with no out-of-pocket costs for COVID treatment, who are now arguing about whether or not something that's a complication from COVID is still COVID treatment. And that's a really large difficulty.
Families whose loved ones died from COVID left with a dizzying maze of vague and confusing charges.
Sometimes they're coded incorrectly, sometimes they're coded correctly, sometimes the amounts don't make sense, sometimes you get a duplicate or it's restated or a bill was rejected because it got restated.
Shabam Chandra lost his father to COVID last fall. The 25-year-old says he had to stop working to help his family when his father was sick, and the family has been left with potentially hundreds of thousands of dollars in bills to deal with.
It's a constant worry of how are these things going to play out and how are we going to deal with that?
And there is no help in sight. Patricia says her insurance has no cap on out-of-pocket costs. She's tried calling the hospital for help.
I get a bill about every few months, a collection notice. And I call the same lady and I don't get a call back.
What are you guys doing with that bill now?
It's in a drawer. It's in a drawer. There's nothing I can do with it. I'm just kind of like, it's going to sit there and we're going to figure it out one way or the other. But for now, I can't do it. Mentally, physically, I cannot do anything more than I'm doing.
If Patricia doesn't get help, she says, the debt from her hospital stay will upend her and her husband's retirement plans.
We're in our 50s. Our output is the same as our input. What we bring in, and we work 2 jobs apiece. So what we're putting out every month for our bills is close to the same as what we're bringing in. And it's just not enough.
Often all of these issues come down to a fight between insurers and providers. And then inevitably their answer is put it on the backs of patients. And the patient is the one with the least power in that situation who's going to get the most hurt.
According to the Census Bureau, nearly 1 in 5 households carried medical debt before the pandemic, and some experts fear the fallout from COVID will only increase this rate.
I've talked to people who ended up selling their house because of medical bills, who've had to stay in a job they hated because of health insurance and medical bills. This is not a one-off event. It is a long-term health issue for millions of people, really, across the world. And people in the United States are not only dealing with these immediate medical bills, but also long-term care.
As for Patricia and Shabam and the countless Americans like them, they can only hold out hope that their families and their futures won't be too impacted by these overwhelming costs.
I mean, I hope we don't have to pay, but it's been 6 months.
The whole situation is very stressful. It's stressful not to be the same person you were a year ago. It's stressful not to know for sure what's going to happen, but we'll get through it. It's just something that I have to add to my plate at some point in time. And I'm not quite there yet.
One more stressor in an already stressful time. Stephanie Ramos joins us now. Stephanie, what can COVID patients and their families do to try to avoid getting hit with surprise medical costs and out-of-pocket expenses?
Well, Lindsay, health experts say most people look at their healthcare providers as authority figures and don't have the courage to ask those questions and push back. Experts say go ahead and do that. Ask the questions. Don't be afraid to do that, even if it's before the appointment. Lindsay.
Stephanie Ramos, our thanks to you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.